Right now, hospitals across the country are at capacity, and in Chicago Southside, one of the city's oldest hospitals is about to close its doors in the middle of this pandemic. It has left neighbors asking, where do we go? Where do we get help? We have team coverage of this critical issue. NBC's Antonia Hilton is live for us in Chicago, and MSNBC's Trymaine Lee reported extensively on this closure for his podcast, Into America. Welcome to you both, guys. Antonia, I want to start with you on this. Since 2018, you got 3 Chicago hospitals in majority black communities, and they have closed. How is this hospital closure going to directly affect that community? What are you seeing?
Hey, Yasmin. So what's going to happen when Mercy Hospital, a historic hospital that has served the black community on the South Side, when that hospital shuts down, its patients are all going to have to flow out into other parts of the systems here in the city. And many of them are going to come right here to Provident. This is a public safety net hospital that regularly works with people who are uninsured and need significant financial assistance. But the problem is that Provident is having its budget slashed too. They are downsizing their ER. They no longer do maternal or birthing services here, which are desperately needed in black communities in this city. And so many of the black residents here in the city feel like they've been completely disregarded and disrespected by this decision. Take a look at what I learned this week.
Etta Davis is angry. She's boarding a school bus in the middle of a pandemic. On her way to protest the looming closure of Mercy, the hospital she depends on.
Mercy! Mercy!
We're tired of hearing that there's no money when it comes to us.
You'd be hard-pressed to find a black person in Chicago who hasn't been hurt by COVID. Black residents have been the group most likely to die of the virus since it began. So the closure of Mercy, a historic hospital dedicated to serving the poor on the South Side, represents another heartbreak.
In this community alone, we have, as I say, over 216 seniors. Then we have a lot of people that are in wheelchairs, walking around with canes, and they can't afford to take Ubers.
What message do you think this closure sends to black and brown neighborhoods here in the city?
I don't know what it's telling them, but it's telling me that you might as well just roll over and die. We don't care about your health.
Mercy Hospital has long had financial woes, and the pandemic hasn't helped. Its owners, Trinity Health, say it's not profitable enough and could close as soon as February. Patients like Davis, who has a heart condition and diabetes, will immediately flow into other hospitals like Provident, which has had its budget shrink too and downsized its ER. Dennis Kosuth was a nurse there, laid off just last week.
Is Provident ready to handle a new influx of patients when Mercy closes?
Absolutely not. There's no way that they're going to be able to handle that. And this is in the middle of a pandemic.
What's your greatest fear?
People get brought to Provident. They can't breathe because of asthma or because of heart failure. They need life-saving measures immediately. And my greatest fear is that someone will be brought there needing those things and not be able to access it. And it doesn't have to be like that.
We spoke with Mercy Hospital President Carol Schneider, who expects this site to turn into an urgent care center.
We're in the middle of an unprecedented pandemic. Is there not something that can be done to either reverse this decision or to delay it for a couple years?
We really want to take into consideration some work we're doing to place all of our programs, place our patients, and place our staff in other healthcare facilities in the Chicago area. And we'll take the COVID surge into consideration when we set a final date.
While she's holding out hope that a new owner buys and restores Mercy, Etta Davis is already asking her doctors to gather up her medical records as she tries to stay healthy.
Do you think this is the last time you're going to fight a hospital closure in a black community in Chicago?
Oh, no. I'm in it to win it. I'll be out here, bundled up, marching again and again and again.
Provident Hospital, you should know, is an additional 3 miles away from the community that's served by Mercy Hospital. So, while 3 miles might sound like a short distance to you and to me, the reality is if you are like Etta, you're living in a community with people on limited income, many people who are disabled, those 3 miles might be the barrier that stops you from getting life-saving treatment. Yasmin?
Trymaine, it's shocking to hear Etta describe how the community is feeling, the black community is feeling in the closure of this hospital. You might as well roll over and die because we just don't care. I mean, that is so incredibly sad to hear Etta Davis say something like that, but it is only exacerbating this existing healthcare disparity that we have in the black community, specifically from maternal mortality to now COVID. You actually spoke with a physician who talked to you about how we can actually change things. What did that doctor have to say?
Yeah, I spoke to Dr. Thomas Britt, who says certainly there needs to be a wholesale reconsideration of how we deliver health care in this country, and that folks in poor, disinvested communities should have access to better urgent care, primary care, and also preventative care. But one thing I learned in this episode of Into America and talking to Dr. Thomas Britt is how hinged health outcomes are to systemic and structural racism. But let's take a listen to what Dr. Britt had to say.
There is blame all the way around. The question is, do you acknowledge that you contribute to this, and what can you do to make it better? And then, so if you acknowledge it and you're a politician, if you acknowledge it and you're a corporate entity, and you acknowledge that you're the physician who didn't give this Black patient cardiac catheterization, if you acknowledge all these things, are you willing to make a change? And the change is not going to come overnight. We didn't get into this mess overnight. We won't get out of it overnight. But we have to start, and we should start tomorrow.
When you think about this tangle of race, healthcare, and economics, it's clear that the burden and the weight is falling squarely on the backs of Black and poor communities all across this country, like this one on the south side of Chicago.
All right, Antonia Hilton, Tremaine Lee, thank you to you both guys on this incredible reporting. Appreciate it. And
hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.